Welcome to the BMA Job Planning presentation for consultants and for staff and associate specialist grade doctors in England, Northern Ireland and Wales. I'm Helen Fiddler, Deputy Chair of the UK Consultant Committee and a consultant in South London. We're here to help you every step of the way in achieving a job plan that works well for you, for your patients and for your trust. And you can ring us on our first point of contact number shown at the end of the presentation. First, let's talk about your contract and your terms and conditions of service. Many of us have never read them, but please do. Both the consultant and the staff and associate specialist grade model contract and terms and conditions are on the BMA website, and there's some really useful and enlightening information in them. Your job plan is part of your contract of employment. This means that, like any other aspect of your contract, your employer must consult with you and try to reach agreement over any proposed change. Your job plan must be fully agreed, not imposed, and based on a partnership approach with a fair resolution of differences. This is part of your national terms and conditions of service, and a unilateral imposition could amount to a breach of contract. Having said that, job plans are not set in stone. There is an expectation that job plans will need to change over time to reflect your varying needs, different service needs, new treatments, new patient pathways, and so on. Either you or your clinical line manager can request an interim job plan review any time. You don't need to wait for your annual job plan review if your circumstances have changed, affecting your work requirements or workload. You should not agree to proposed changes to your job plan if you believe them to be unfair. It is perfectly reasonable to say that you're not happy with the suggestions made and ask for time to consider. The terms and conditions of service set out a clear process for resolving disputed job plans, and it's a simple and timely process. In the first instance, this involves mediation, and if that fails to resolve matters satisfactorily, you then have the right to take the dispute to formal appeal. More on this later. Your job plan should set a timetable of activities and show the number of programmed activities of each type that are included in the job plan. For most consultants and SAS grade doctors, these will consist of direct clinical care programmed activities and supporting professional activities only. However, some consultants may have programmed activities for what are termed additional responsibilities. For example, if you hold a clinical management post, while some may have PAs for significant external responsibilities, such as Royal College or BMA responsibilities. The job plan should also set out your on-call arrangements. Where your job plan has more than 10 programmed activities, the duties to which the additional programmed activities relate should be clearly identified. But your job plan is so much more than a timetable of your weeks. It should also set out your objectives, what you aim to achieve professionally, and what would make your job more effective and rewarding. These must be agreed with you, together with any supporting resources that are needed to enable you to achieve those objectives and to fulfil your job plan. This is part of the job plan that cannot be overlooked, but it is an essential part of the meeting, and you should prepare your objectives in advance so they can be discussed fully and constructively. You may prefer to discuss your objectives first in your job plan meeting to ensure adequate focus is given to this and to set the scene for subsequent timetable discussions. Finally, the job plan should include any regular, private and fee-paying work you carry out. This information includes the planned location, timing and broad type of work involved, and sharing it is intended to help avoid conflicts between NHS responsibilities and private practice. So, who does the job planning? The terms and conditions of service state that the job plan review meeting should be conducted between the consultant and their clinical manager. The terms and conditions are silent about the involvement of any third party, for example, a general manager. Whilst this may be helpful in some cases, third-party involvement in the job plan review meetings should only be with the agreement of the consultant. Where there are a number of consultants carrying out essentially the same duties, then it may make sense to conduct job planning as a team exercise, and certainly to address any generic issues. However, there's no requirement to undertake team job planning, and if you prefer, you can ask to have an individual job plan review meeting instead. This might be preferable if you do not feel confident that your colleagues share the same needs in their job plan as you do. We're now going to look at examples of each of the 4 categories of programmed activity that may appear in your job plan. Direct clinical care will usually encompass the majority of your activities, typically 7.5 PA in a 10 PA job plan. It covers any work directly relating to the prevention, diagnosis and treatment of illness, and also covers emergency duties, including emergency work arising whilst on call. Direct clinical care includes outpatient activities, clinical diagnostic work, multidisciplinary team meetings, and any administration directly related to these activities. For example, letters to GPs, liaison with family and carers, chasing results, other admin time related to clinics and lists, and admin related to clinical complaints, serious adverse events, or DATICs. Emergency work carried out whilst on call should be the first calculation when analysing your job plan. It is separate from and additional to the on-call allowance. The best way to determine the appropriate level of programmed activities that should be allocated to emergency on-call work is through a diary exercise carried out over the on-call rota period. This can then be used to provide an average figure, which should be included in the job plan, remembering, of course, that during premium time and at weekends and bank holidays, a programmed activity is 3 hours duration. Any predictable work you carry out whilst on call, for example ward rounds, should be included in your job plan as part of your direct clinical care programmed activities. Let's now move to supporting professional activities, or SPAs. Supporting professional activities are an essential part of your job plan. They include participation in training, medical education, continuing professional development, formal teaching and non-clinical audit. In addition, time spent in job planning, appraisal and revalidation activities and some mandatory training should also be designated as SPA time. The amount of SPA time that needs to be allocated to revalidation alone is 1.5 PA per week for all consultants and SAS doctors. That is 6 hours, as recommended by the Academy of Medical Royal Colleges. Research activities, clinical management and local clinical governance activities also come under the SPA category. Supporting programmed activities are under increasingly aggressive scrutiny by cash-strapped employers. Unlike direct clinical care, SPA activities generally do not bring money into the organisation. Nevertheless, SPAs are essential work which underpin direct clinical care activities. The model contract states that for consultants, a job plan consisting of 10 programmed activities typically comprises 7.5 PAs of direct clinical care and 2.5 PAs for supporting professional activities. If you have less than this, ask your trust in what way your job plan is atypical. Again, the BMA can advise on this. For SAS doctors, 1.5 core PA is required. Given the fact that SPA allocations are coming under such pressure from employers, it is advisable to keep a record of your SPA activity in order to provide evidence that you're using the time currently allocated to you, or in order to demonstrate that you require more SPAs in order to fulfil your duties. It is entirely possible to receive more than 2.5 programmed activities for your SPA time, provided it's for activities which have been agreed as part of your job plan. NHS Employers, in its guidance on supporting professional activities, states that in order for NHS organisations to attract medical staff, both non-training and training grades, a culture of education and training needs to be further developed within the NHS. To ignore this would have a detrimental effect on recruitment, retention and return. An employer which develops a reputation for not valuing supporting professional activities is likely to be storing up problems for itself in the future. What sort of things should you be aiming for in your objectives? Job planning, as the terms and conditions of service make clear, should be based on a partnership approach. It follows that individual objectives must be agreed and not imposed, and they should be based on a reasonable expectation of what might be achievable. Your objectives should be specific, measurable, achievable, realistic and timed to avoid any ambiguity about what is expected. It is time well spent to prepare for your job plan by thinking about what objectives you would like to achieve and what you need to do so. Objectives can be related to quality, activity and efficiency, clinical outcomes, clinical standards, service objectives, management of resources, service development, and multidisciplinary team working. And when considering objectives, you should be mindful of factors outside your control that may impact on your ability to achieve them. So consider what your trust needs to provide for you to meet the objectives, and which objectives you would like to set, and how they can help you achieve them. Supporting resources identify what you need from your employer in order for you to be able to achieve your objectives and fulfil your job plan. Inadequate supporting resources can impact not only on achievement of objectives, but also on other areas, such as revalidation. Supporting resources can include secretarial and administrative support, or audit or clinical governance support. You may need access to training, improved IT, or access to a particular database. Similarly, achieving your objectives may require adequate office space, an allocation of time, or improved support within your medical staff team, such as specialist nurses, physiotherapists, or other support staff. If this support is not in place following a job plan where it is agreed that it is needed, you should ask for a job plan review and explain this. So, if your secretarial support or clinical nurse specialist support changes, the Trust may need to adjust your job plan, and you are entitled to request this. Junior rota gaps or unappointed posts can impact on you meeting your objectives, and this should be discussed and solutions found. If you're going to achieve a good outcome to your job plan review, then preparation is essential. Don't just think about getting through it without detriment. Prepare your data to drive the discussion towards improving your working life and the welfare of your patients. If you believe some elements of your job plan are likely to come under scrutiny at the job plan review meeting, or if you want to build a case for more time to be allocated to some aspects of your job plan, then you should keep a job plan diary over a representative period of time. This will provide important evidence to help you analyse what is actually being done. As part of your preparation, consider whether there are workload problems within your working environment that need to be addressed. Do you have the resources needed to do the job safely and effectively, including adequate staffing levels? So, as I mentioned in the previous slide, if you're regularly being asked to act down in emergency situations, then this is an issue that should be raised at the job plan review to agree steps to address the root causes of such situations, and your LNC can help advise you. If there are problems with staffing with other groups, such as nurses, which reduce the efficiency with which you can work, you should raise this, and the job plan should accommodate the extra time needed. Use the job plan review to be proactive. Are there, for example, ways to change the job in order to deliver a better quality service to patients? Is it possible to achieve a change in your role that would help you towards your career development ambitions whilst benefiting the organisation? If you want a good outcome to your job plan review, then in advance of the meeting you need to identify and gather all relevant information and data that you need to support your case. If you can, try to avoid a confrontational approach at the meeting itself and aim for an outcome that both sides are happy with. Remember, job planning should be based on a partnership approach. Job planning isn't something that is done to you. You're an equal partner in this process, and any discussion and agreement should be conducted on that basis. Starting off with objective setting before moving to timetabling may be something you should consider. When it comes to the meeting itself, be clear in advance about who is going to attend. Any third-party attendee should only be there with your agreement. Confirm that the sole purpose of the meeting is your job plan review meeting and not any other matter. It's also useful to ask in advance if there are any particular issues or data sets that would be raised so you have time to consider them in advance. If this is sprung on you during the meeting, it's not unreasonable to ask for the meeting to be deferred to give you time to consider your response. And make sure sufficient time has been set aside for the actual meeting, at least an hour, and that the meeting will be free of interruptions. If you do agree and finalise the objectives and timetable in your meeting, get it put in writing soon afterwards so it can be signed off by both parties. Unless it's signed off, it's not formally agreed. You should not sign up to a job plan review you believe to be unfair or unacceptable, or which has been adjusted by your trust to fit an e-job planning template. If you feel you're being undermined, bullied or harassed during the process, then contact the BMA. It's totally unacceptable and unfortunately not uncommon. If you aren't happy with the job plan proposed, you can decline to sign it off and ask for mediation. This would normally be with a medical director, provided he or she is not compromised through direct involvement earlier in the job planning process. If you still don't agree after mediation, then you can take the matter to a formal appeal hearing, and the BMA can provide advice and support throughout this process. The mediation and appeals processes form part of your terms and conditions of service. You have a contractual right to seek mediation and take forward a job plan appeal, and you should not be subject to any detriment because of exercising that right. The mediation and appeal processes provide an opportunity to discuss your job plan fully and openly, with both sides of the dispute being heard and considered impartially. In the mediation process, make sure that all the evidence to support your case is brought into the discussion, and we can help with this. At the mediation stage, you do not have a contractual right to BMA representation, although you can ask your trust for it and they may agree. However, you can ask for an adjournment at any time during the meeting and have a BMA advisor at the end of the phone in order to obtain advice from the BMA. The overwhelming majority of job plan disputes are resolved at the mediation stage. But if you don't agree with the outcome of the mediation, you have the right to take the matter to formal appeal. At this stage, you're entitled to have a BMA colleague present, and they will help you every step of the way. The hearing will take place before a 3-member panel consisting of a management side nominee, your own nominee, and a third member taken from a list jointly managed by the BMA and NHS employers. Both sides of the dispute will be invited to present their case. Each side may be questioned by the panel and by the other side. At the end, each side will be given an opportunity to sum up their case. The decision of the panel is final. Finally, remember that the BMA is here to support you in your job planning process from start to finish. Our first point of contact advisors can be contacted on the numbers shown on the slide, and your local LNC is ready and willing to help you. Preparation is key, and by listening to this presentation, you should be well on the way to a constructive, respectful, and straightforward meeting. Good luck!